Hi, this is Luz Maria Clayton, and today I'm going to be doing a public service announcement regarding xylazine, which is also known as tranq or the zombie drug. Xylazine users often develop severe wounds on their skin that can arise most often on their limbs. If untreated, the wounds can become necrotic and require amputation. Tranq has been called the zombie drug due to the stupor that it causes in some users. Xylazine was created in 1962. It was originally developed as an animal tranquilizer used by vets. It was found to be an effective central alpha-2 adrenergic blocking agent. Alpha-2 adrenergic agonists are a type of drug that mimics the effects of the hormone norepinephrine. They are used to treat several conditions including high blood pressure, anxiety, and panic disorders. Here's some examples of some of the medication. As an agonist, xylazine leads to a decrease in neurotransmission of norepinephrine and dopamine, the feel-good factor. Dope with xylazine was first seen in Puerto Rico in the early 2000s and began popping up in Philadelphia soon after. It's being found in more places across the US. These are images from Kensington in Philadelphia, also known as Zombieland, just depicting how bad it's gotten. Routes of administration include injection, snorting, swallowing, inhaling. These are the overall symptoms and health risks of xylazine. Sedation, dangerously low blood pressure, difficulty breathing, slowed heart rate, wounds that can become infected, severe withdrawal symptoms, even death. I would like to share how the use of xylazine impacts the integumentary system. It is the largest organ of the body that forms a physical barrier from the outward environment. The integumentary system includes epidermis, the dermis, hypodermis, associated glands, and of course hair and nails. This system also performs many complicated functions such as bodily temperature regulation, cell fluid maintenance, it soaks in the vitamin D, and detection of stimuli. The skin and hair provide a barrier against harmful substances, UV rays, and temperature extremes. The skin contains nerve endings that detect touch, pressure, pain, heat, and cold. As far as the DEA is concerned, xylazine is not currently a controlled drug under the Controlled Substances Act. Congress has yet to determine the legitimate use of xylazine in people. If it is not deemed safe for treating humans, then it can be added to the CSA list. This will allow the DEA to regulate the drug. The Combating Illicit Xylazine Act is calling for xylazine to be classified as a Schedule III drug and invoke penalties on those who choose to abuse and distribute the drug. According to the CDC, in 2021, the age-adjusted deaths involving xylazine was 35 times higher than the 2018 rates. Xylazine use can lead to the development of skin wounds. These wounds are seen regardless of how people use. Whether they smoke, snort, or inject the drug, it's very difficult for those wounds to heal on their own. It's important to try to seek medical attention. This is the PG version of the wounds. Xylazine combined with other substances can develop necrosis, the rotting of human tissue. That may lead to amputation. Chronic use of xylazine can cause peripheral vasoconstriction and skin oxygenation deficit, leading to severe soft tissue infections, including abscesses, cellulitis, and skin ulceration. Xylazine mixed with fentanyl or heroin can lead to abscesses and painful skin ulcers. Cellulitis is a deep infection of the skin caused by bacteria. It usually affects the arms and legs, and it can also develop around the eyes, mouth, and other parts of the body. Prolonged use can lead to decreased perfusion and impaired wound healing, leading to high chances of infection of ulcers. Perfusion is the passage of bodily fluids such as blood through the circulatory or lymphatic system to an organ or tissue. Narcan can be used to reverse an overdose when xylazine is used in combination with an opioid. Sadly, it does not address any breathing complications. People can become dependent on xylazine. Another problem is drug traffickers have been known to add xylazine to more expensive opioid products to cut costs and increase profits, and they sell them to unsuspecting users. Xylazine is also spreading to use with stimulants as well as opioids. The toxic amount of xylazine is currently unknown. Due to the severe appearance of wounds on people using tranq, drug clinics are not always willing to take users in as patients. Tranq has been detected in at least 48 states. This concludes our public service announcement regarding xylazine. Remember to say no to drugs, and if you or someone you know is struggling with drug abuse, feel free to call the hotline below. Thank you for watching.